Question number 2 is, how are you going to provide reasonable health care for those in need in all parts of Saskatchewan? And that was from Grayson School in Grayson, Saskatchewan, and we thank you for that question. Healthcare is a very important topic, and it's very dear to me because I spent 20 years working in healthcare in Saskatchewan. While I was working in healthcare, I got to know quite a few doctors, both within and outside of Saskatchewan, and I was always interested because a lot of physicians from outside of the province, they have little standalone clinics all over Alberta, all over British Columbia, and all over other provinces where they provide medical services in some of the smaller communities. I've always asked them, why won't you do this kind of thing in Saskatchewan? And their response was, there's too much regulation and red tape in Saskatchewan to come in and set up a clinic. We have to start treating doctors what they are. They're people, obviously, but they're also a business. So they're in it to make some money as well. And we have to start treating them like that and treat them as an investment. So we want to look at some specific tax incentives to get more physicians to open up shops or not shops, but clinics in smaller communities, so that we can have better access to health care for these folks. We're also interested in improving some sort of a public health or public transportation program, so that folks that live in communities far away from some of the major centers can access this public transit and get down to medical appointments in larger centers. We have to sort that out. And I know that a lot of folks, when STC was canceled, were left without that option, and so they had to make alternate ways to get to their medical appointments. So we will work with the current bus companies that are working in Saskatchewan to try to encourage or provide some sort of a subsidy to them, so that they can actually provide some services of transportation services to our more remote communities, so that folks can get down to their medical appointments. These are very important questions now, and we need to actually address them.